Let's talk about some of the most important features of the literature assignment for today. These are the highlights, but as always, we can discuss more in class if you're interested. This question generally comes up when discussing comments about sentences like the one shown. And no, when it says someone has an MRSA carriage, what it means is that the MRSA bacteria now has colonized the person as a part of their bacteria flora. It's not actively making them sick. However, because they are carriers of it, if they do get a cut that gets infected, it's much more likely to be MRSA because they didn't have to acquire both the cut and the specific bacteria, but rather already had it on them. There are protocols to try and remove this colonization. It involves sticking a specific type of antibiotic up your nose and showering with a strong disinfectant, but its efficacy is not particularly well established. Another issue between the two articles that I want to bring up was the concern around community-acquired versus hospital-acquired forms. It's worth talking a bit about how much bigger of a deal it becomes when something can be community-acquired. MRSA largely started in healthcare facilities where patients who were being continually pumped full of the standard antibiotics and having procedures with high risk of infections were. And this provided a perfect breeding ground for antibiotic-resistant bacteria. And while this is definitely bad, as it means it was often happening to very sick patients, those patients were also almost expected to wind up with such things. They are being closely monitored for it, and it's a pretty limited spread. Once we start seeing community-acquired cases, we know that this has become a widespread infection that now everyone has to worry about. And that includes the doctors when you come into the hospital. They have to assume that you may in fact have MRSA instead of a regular bacteria, even though you haven't been in the hospital. And also, people may think that they just have a regular skin infection, treat it casually with a bit of triple antibiotic ointment, and not realize that if it gets into their bones or their joints, they could even lose a limb. As a personal anecdote, I actually watched someone with reasonable medical training who was tasked daily with treating skin infections write off his own infection until it was so bad that he wound up in the hospital for over a week with it, thankfully with all limbs still fully intact. Take a moment and read this. The link is in the slide notes, modules, and YouTube descriptions. I think it's worth reading the entire thing, but if you really don't want to, I've copied over the most poignant quote from it. Go ahead, pause, and come back when you're done. So this is obviously a bit terrifying. As someone who teaches this class every year, I'm always amazed, in a bad way, how many things have changed year to year. When we started this class, it was something that we mentioned as a thing to worry about in very specific areas outside of our country. Before long, it was something to be concerned about in Hawaii. And now it's made significant infection progress into the mainland US. And this is really scary because now we have a really deadly, but also very, very spreadable disease. HIV is horrifically scary for its impact on lives, but just due to statistics of sexual preferences and its low risk of infection for most sexual acts, for most of us, the risk of spread is pretty low. This isn't true of gonorrhea, which has a very high rate of infection rate, even for low-risk sexual acts.